Okay, so I'm going to be doing my ENT and cardiac exam on my patient. So first, I'm going to be just inspecting my patient's auricles, both the anterior and posterior. So just looking if there's anything abnormal that I see. I'm also palpating the external ear as well as the mastoid for any tenderness. Let me know if you feel any pain or anything.
No
Okay.
pain.
And then I'm also looking at the external ear just to see if there's any cerumen, drainage, or lesions. And I don't see any. And I'm also looking at the other ear. Okay? And then I'm going to be using my otoscope to look inside your ear. Both ears. Okay? So I'm just going to turn it on. Okay? And then I'll be looking at into my patient's ear, just seeing if there's any cerumen, noting that the tympanic membrane is intact. It is a pearly gray color, and I see the landmarks. Okay, and then also looking at the patient's other ear and doing the same thing. So I'm just shining my light in the patient's ear, and then checking for any cerumen, checking the landmarks, making sure that the tympanic membrane is intact and a pearly gray color. Okay, and that's good there. So now I'm going to be testing your hearing with your cranial nerve 8. So I want you to cover one ear, and I'll whisper a word in your other ear, and then just let me know what word you heard.
Okay. Apple.
Okay, good. And then if you could cover the other ear.
Car.
Okay, good. So I'm done with the testing my patient's ears. Now I'm going to be moving on to my patient's nose, just checking out his facial features and skeleton, making sure they're symmetrical. Looking at the patient's nose, I'm going to be using my otoscope again to look into your nostrils, both left and right, if that's okay.
Okay.
So I'm just going to turn it on again. And looking inside, looking at the septum, both left and right, and looking at the turbinates, just making sure that there's no septum deviation, no lesions, nothing abnormal, no perforations, looking at the mucosa, making sure that it's pink, and doing the same in the other nostril, making sure that everything looks okay and looks normal. Okay, well, that's good. And then I'm going to be checking your sinuses, so I'm going to be palpating your face if that's okay.
It's okay.
So I'll be...
Will I take off my glasses?
Sure, yes. So I'll just be palpating the patient's frontal and maxillary sinuses, so let me know if you feel any pain or tenderness or anything.
No pain.
No? Okay, so that's good.
Okay.
Okay, so I'm done with that if you want to put your glasses back on.
Thank you.
Okay, so now I am looking at the patient's mouth and pharynx. Looking at the patient's lips right away, I see that they're a good pink color. There's no cyanosis. There's no dryness there. So if you could open your mouth, and I'll just be looking inside your mouth. Looking at the patient's buccal mucosa, just making sure there's no lesions. Looking at the patient's tongue, making sure it's a good color, good papillation, pink. There's no lesions there. Looking at the patient's hard palate and uvula, making sure that there's no lesions and it's a good color as well. And then looking at the patient's sublingual area, making sure there's no lesions, and then there's saliva there as well. Also looking into the patient's teeth and gums, just making sure that the patient has good dentition, there's no absent teeth, no dental caries, and the gums have no edema, no erythema, and the gums are not bleeding. So that's good. So then testing your tongue, if you could, stick it out midline, so that's good. So that cranial nerve is intact. As well as I'm just going to be using my light and looking inside. If you could say, ah, and then the patient's uvula does rise up midline, so that's good. His cranial nerve 9 and 10 is intact. And then I'm just looking back there again, looking at the patient's tonsils. They are intact, about a size 1, good color, no edema, no inflammation there. And then looking at the patient's posterior pharynx, there's no lesions, no exudate on the tongue. Just making sure everything looks normal there, and it does. Okay, thank you.
Thank you.
So then I'm done with that, and now I'm going to be looking at and feeling the patient's neck and thyroid. So just looking at the neck, making sure that there's no enlargement, just inspecting, and then just palpating from the sternal notch, both left and right, making sure that it is midline, and it is. As well as the thyroid, I'm also palpating for, let me know if you feel any pain or tenderness or anything.
Right.
I'm palpating for nodes. I don't feel no tenderness there.
No.
Okay. So that's good. And then now I'm just going to be palpating your nodes for any tenderness or pain, so let me know if you feel anything.
Okay.
Okay? So in a circular motion, I'm just going to be palpating the patient's pre-auricular, post-auricular,
Okay.
occipital, the patient's tonsillar, the patient's submandibular, submental, the patient's anterior cervical, both superficial and deep, and the patient's posterior cervical, and then again the patient's supraclavicular, and the patient's infraclavicular, and then the patient's epitrochlear on both sides. If you could just bend your arm, and then I'll just feel here. And then the same thing with this arm. Okay? Thank you. And then I'm going to be just palpating the patient's carotid on both sides, making sure that they're present, and they are about a 2+ pulses bilaterally. And then I'm going to just be auscultating for any breweries. So I'll just be listening.
Okay.
Okay. Okay, thank you. So that's good. So then now I'll just be moving on to the patient's heart and vasculature. So then I'm going to lean you back in this chair here, and then leave my patient at about a 30-degree angle now, so I'm able to see his neck. If you could look to your left for me. So then I'm just looking and examining, trying to see the patient's jugular vein, which I do see it here. Okay, and then if you could look back, and then you can sit back upright again.
Okay.
Okay. And then I'm just looking at the patient's precordium, just seeing if I could see anything abnormal, like any heaves or lifts, which I don't. And then I'm just going to be palpating your precordium to see if I feel any thrills or anything abnormal, which I should not. Okay? 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 And I don't, so that's good. So then, just going through those areas again, I'm going to be auscultating the patient's aortic, pulmonic, tricuspid, and mitral regions, with the aortic and the pulmonic being in the second intercostal space, the tricuspid being around the left lower sternal border, and the mitral being around the 4th or 5th intercostal space mid-clavicular line. So first I'm going to be just listening to those spaces with my diaphragm for any S1, S2 sounds. Okay. And then again, making sure to go under the shirt to listen to the patient sounds. Okay, sound normal. And then now I'm going to be listening to those areas again, but then flipping it over and listening with the bell to see if I hear for any S3 or S4 sounds, which are abnormal sounds, so I shouldn't hear any. Okay, and then I didn't hear any, so that's good. Your heart is a regular rate, regular rhythm. I was able to hear S1 and S2 sounds, and I didn't hear any abnormal S3 or S4 sounds. So now I'm going to be listening to your mitral area with my bell, just to hear if I hear any murmurs, mitral murmurs. So if you could just like lean to your left side, and I'll just be listening to the mitral area. Okay, and then if you could just sit upright like that, and then I'll be using my diaphragm to listen to the aortic area to see if I hear any aortic murmurs, which I should. Okay, that's good. Okay, thank you. And then now I'm just going to feel and listen to the patient's apical impulse, which is located kind of around the mitral area, the fourth or fifth intercostal space, mid-clavicular line. So first I'm just going to palpate and then see if I feel anything. Normally I would just be here and then count for 60 seconds, 1 minute, to see what the patient's heart rate was, but I did it earlier and his heart rate was about a 75 resting, so that's good, that's normal. And I'm just going to be listening as well to see if there's anything there. Okay, thank you. And then the last part of my exam, I'm just going to be palpating all of your pulses bilaterally to make sure I can feel for them, they're a good feel, and making sure that they're there. So starting off with the patient's head, his temporal pulses. Okay, so they're good. And then I'm going to feel the patient's radial pulses bilaterally. Okay. And then I would be feeling the patient's femoral pulses. Again, I would move down and then feel the patient's, if you can put your foot up there, yep. I will feel the patient's popliteal pulse, which I know might not be found in all patients. Okay. And then I wasn't able to palpate this patient's, but it's okay. Okay, and then if you want to put both of your legs up so that way I can palpate both of them. Okay, so I'm going to palpate his dorsalis pedis pulses as well as his posterior tibial pulses. Okay, and then I'm able to palpate all of them. So now I'm just going to be looking at the patient's lower extremities, examining for any varicosities, any arterial insufficiencies. I don't see any redness, normal color and everything, and I'm just going to be palpating for any edema, and I don't see any, so that's good. So that concludes my exam, and everything that I found was normal with you.
Thank you.
Thank you.